Let's bring in Gemma Tognini from GT Communications and Christy McSweeney, Managing Director of PR Council. Let's go to you first, Christy. This is just frightening to see young people treated in this way. We know they're vulnerable. We know they consented at the time, but now they regret it, which just underscores why we shouldn't be doing this to people quickly or while they're young.
There is a rush, I feel, from the medical community to perhaps not diagnose other underlying mental health issues or do complete mental health assessments. And it not only leaves the children in vulnerable positions, it leaves parents who are so worried about their children who are undergoing these issues. They are clutching at any diagnosis that they can get that might improve the quality of life of their child and might have their child at peace. Parents are watching terrible social media consequences of children taking their own lives, and they are scared that if they don't go along with perhaps a diagnosis that may not be the right one, such as a transgender issue, that their child is going to come to significant harm. Of course, not taking away from the fact that there are several children who are struggling and several families out there who are. But there is a right to have a lot of these assessments questioned and perhaps to be a lot more thorough and to work with parents and the children themselves to come up with a diagnosis that may not be this one.
Yeah, a lot more thorough, a lot more cautious, spend more time, consult more widely. Yet some people defend what's going on. Here's Australian psychiatrist Professor Ian Hickey.
It's really interesting that more kids are coming forward for care.
How do you explain
that? Is a good thing. The idea that we are simple binary people, simple male, female, and happy with that, does not respect what has been known for centuries, that a great number of young people are not so binary, they're not so fixed. As our whole society becomes more inclusive and less rigid, more kids are coming forward. This is not just simply a fad. It's not just simply a fashion.
Really?
It's going closer to what has always been the reality.
Gemma, that really worries me. He's saying it's a good thing more people are coming forward, that we're not binary. I mean, cheapest.
Well, I didn't see the fullness of Liam's story last night. I'd love to see the data that particular doctor would use to back up such a bold claim that this is actually who we have been for centuries. I'd also point him to the global trend where leading public health and private practitioners all around the globe are running as fast as they can away from gender-affirming care. Tavistock, let's talk about that for 30 seconds. Look, the reality of it is this, Chris. Young people in our society deserve our protection. That means that we say things like they can't drive, they can't have sex or be subject to sexual relationships when they're underage, they can't go to war, buy a house, all of those things. So why in this sector alone or in this space alone are there sections of the medical community and others who say, no, anything a kid says is untestable and we have to just affirm this kind of care? It is I think it's unwise, and it's certainly not doing the child in question the right service. They deserve better than that sort of, let's just go along with it. And I think the other thing that we've seen, and this is a recognition of perhaps the reality underpinning some of this, is medical insurers in this country. It was reported a couple of months ago, that at least one major medical insurer has said to doctors, you're not going to be covered. And if we made these doctors responsible for the outcomes of this kind of treatment in perpetuity, I wonder what the outcome would be.
Yeah, wise words, Gemma. It's such a worry, and they ought to just pull back on this stuff pretty dramatically.